Thank you so much for joining us all today. I'm Melissa Marshall, and I'm the coordinator of the Connecticut Cross Disability Lifespan Alliance. I'm going to be introducing the first panel and moderating the second panel. First, I want to give you a little bit of background about this event for those of you who didn't join us in the past. We have 70 people registered for today. We're thrilled to have you all joining us, so thank you for being here, and we really appreciate your participation. On March 19th, 2020, doesn't that seem like 100 million years ago? The Connecticut State Independent Living Council, the CT-SILC, and the Connecticut Protection and Advocacy Organization, Disability Rights Connecticut, sponsored a webinar. The webinar was called COVID-19 and Equal Access for People with Disabilities. Amazingly, over 150 participants joined the webinar, which is still available for you to view at YouTube. We're going to be sending out a link to that presentation as well as this presentation afterwards. Since the March 20th webinar, the Connecticut disability community has diligently worked with Governor Lamont's office and various state agencies and other stakeholders on related issues to COVID-19 to include, but not limited to, medical rationing, visitation, personal care assistance, and congregate setting and nursing home recommendations, nursing facility, I should say, recommendations. Based on an August survey administered by the Connecticut State Independent Living Council, there's an overwhelming interest from the disability community to host another webinar and to continue the conversation in equal access for people with disabilities during the pandemic. The survey included the top two issues, which are concurrent disasters and partnering with aging and disability organizations during the pandemic. Therefore, today from 4 to 5:30, the Connecticut State Independent Living Council, along with national and local experts, is holding part 2 of COVID-19 and equal access for people with disabilities. We have an amazing series of panelists. We have an amazing group of panelists today. We have amazing local and national experts. I'm going to introduce you to the first panel, and then Marcy Roth is going to take that over, and then I'll introduce you to the members of the second panel when we begin the second panel. On the first panel we're privileged to have all of these wonderful people with us, and we're truly excited to have this really amazing panel of experts with us. Jessica Michaud is a social worker and a mother of 2 children with disabilities. She's the founder and vice chair of Trach Mamas, one of the nation's leading disaster organizations. Trach Mamas was originally developed in 2016 as a Louisiana advocacy organization for parents of children with complex disabilities. However, Jessica quickly learned how difficult it was during a natural disaster to find supplies for all people with disabilities, and in 2017, the organization expanded to a national organization. She's become a leader on opportunities to improve community accessible disaster readiness and in disability inclusive resilience. Christina Mills is the executive director of the California Foundation for Independent Living Centers. In 1999, she began working for the Independent Living Center of Orange County, the Dale McIntosh Center, and then for Access to Independence in San Diego, and served in a number of various positions over the last 5 years. She was there. She served as the California State Independent Living on the California State Independent Living Council, the National Council on Disability, Youth Advisory Committee, and was a project consultant for the National Family Voices Kids as Self-Advocates CASA program. Sadie Martinez is the first Access and Functional Needs Coordinator for the Colorado Division of Homeland Security and Emergency Management. Prior to this role, she worked for the Independence Center in Colorado Springs as an Independent Living Program Manager, Emergency Program Coordinator, and a Specialist for Community Transition Services. Maria Town is the president and CEO of the American Association of People with Disabilities, AAPD. Prior to this role, she served as the director of the City of Houston Mayor's Office for People with Disabilities and is the former senior associate director in the Obama White House Office of Public Engagement, where she managed the White House's engagement with the disability community with older Americans, I should say. Marcy Roth is the Executive Director, CEO of the World Institute on Disability, WID, the President and CEO of Inclusive Management Strategies, and the former CEO of the Partnership for Inclusive Disaster Strategies, Inc. Marcy provides expert consulting on disaster risk reduction globally through inclusive management strategies. Appointed by President Obama to FEMA from 2009 to 2017, she served as a senior advisor to the administrator and as the congressionally mandated disability coordinator for the agency. While at FEMA, she established the Office of Disability Integration and Coordination, ODIC, serving as its director. Under her leadership, ODIC led national transformation towards integrating the access and functional needs of the whole community throughout emergency preparedness and disaster response, recovery, and mitigation. I'm going to turn this over to Marcy now.
Good afternoon, everybody. I'm Marcy Roth. I am an older white woman. My hair is pulled back, so you can't see how gray it's gotten since last time we were together in March. I'm wearing red glasses, a black and white top, and I am sitting in my family room with my kitchen behind me. My pronouns are she and her. I am very appreciative of the opportunity to be with you today, and thank you very much to Daria and Melissa and to the team for putting this very important discussion together and for bringing us together to talk about concurrent disasters. There are many people who have been saying for the last 6 months, boy, we sure couldn't have seen this coming. And I have to say, actually, we did see this coming. There is a group of us who have been working on preparing for emergencies and disasters for many years. For a number of us, we have been well aware that there was the potential for pandemics. We as well were very well aware that along with the potential for pandemics, there could be concurrent disasters. And through the leadership of the Partnership for Inclusive Disaster Strategies, many of us started coming together on actually February 28th to begin meeting on a daily basis, literally each and every day since February 28th, 7 days a week, weekends, holidays, and we have been talking about, first and foremost, what happens for people with disabilities throughout the pandemic, what happens when there are concurrent disasters, and how we can bring to the attention of emergency managers, public health, elected officials, and many, many other of the key stakeholders who need to be planning with us, and the whole community needs to be focusing on what's happening during the COVID pandemic and as concurrent disasters occur. Right now, many of you have been dealing with concurrent disasters, and I know as I look at the list of our panelists that we have folks who have been dealing with a couple of recent hurricanes, the very current impacts of Hurricane Laura, wildfires in a number of states. We've had serious flooding. We've had some earthquakes during this time. We've had a variety of impacts to communities. And we have also seen that, unfortunately, by and large, our communities have not been prepared to accommodate the needs of people with disabilities, and certainly have not been mindful of the rights that people with disabilities have. In fact, since 1973 and the passage of the Rehabilitation Act, every federal dollar is required to be spent in compliance with equal access to every federal dollar that is spent by the federal government or is provided in federal financial assistance to others, grantees, sub-grantees, government, non-government. And despite these legal obligations, we unfortunately have seen not only unprecedented harms to many, many people, but in fact, for people with disabilities, many of whom living in congregate facilities, the devastation from the pandemic has resulted in, we are estimating at this point 60,000, 70,000, 80,000 people with disabilities who have died. Additionally, with the concurrent disasters, many, many more people are in harm's way. They're not being protected from exposure to the virus. And we are here today to talk about the experiences that folks are having, the efforts that many of the people who are joining us are making, and most importantly, what we can all be doing together to improve outcomes for people with disabilities and the whole community before, during, and after disasters, and as well during concurrent disasters. So I'm very excited to be joined by the panelists that Daria introduced you to. These are all people who I have the great opportunity of working closely with on almost a daily basis with many of them. And I'm going to be asking them questions, and we're going to ask each of them to unmute and turn on their video as they're answering the questions, and then we'll be turning off their videos and microphones as each person speaks, just so that you know what the process is for our attendees. This way we'll be able to keep the interpreter on screen at all times. So I am going to ask the first question, and I'm going to ask first Christina, and then Jessica, and then Sadie, and then Maria. And the first question is, please talk about your background before, during, and after disasters. So let's go to Christina first, and I know she has lots to tell us.
Thank you, Marcy. And before I get started, I just want to thank the CT-SILC for putting this lovely panel together, and what a time to be discussing all of this. There is nothing like the present, literally. Just to lay the ground before I answer Marcy's questions about before, during, and after, here in California, we are dealing with COVID-19, as all of you are, as well as wildfires that continue to increase almost daily now for us for the last 2 months. And then the heat wave power outages that are going on across the state. And then in addition to that, California is also faced with planned, proactive, utility-driven public safety power shutoffs. So that means it's different than an outage, than just an outage where your lights might go out for an hour or a few hours. Public safety power shutoff, what we call a PSPS, is multiple days typically. The least we've seen it is almost a full day. The longest we've seen it between last year and this year is 5 days. We've also seen consecutive events where you might have an event happen for 4 days and then have your lights turned back on for 24 hours and go right back into a PSPS for another number of days. So just want to lay the groundwork with that. If I look tired today, it is because I am absolutely tired. We have just experienced our first 2020 public safety power shutoff here in California. And the California Foundation for Independent Living Centers, the organization I run, and a number of our centers for independent living in California are engaged in providing support proactively and during and after during the PSPS events. So to get to Marcy's question, before, during, and after, our organization, CT-SILC, has really been doing disaster work for over a decade, and Marcy's literally not joking when she says that she talks to some of us on a daily basis. Marcy has been a huge part of the California Foundation for Independent Living Centers work in this area. And when she was with FEMA, we had done some events out in California and discussed ways that we could possibly work towards better readiness. And I say possibly because it's an ever-ending situation, and we're always working towards readiness. And yes, by all means, we knew that any of these things that are occurring now could have happened. And there's a number of players and stakeholders that could always be doing a much better job. In one of the areas that I think that is beginning to happen in California is through some of the public outages, the utility outages of power. We last year had started discussing and having a conversation with California's utility systems. We have over 35 utilities in California. There's 3 major utilities. We call them the IOUs, the investor-owned utilities. And they are Pacific Gas and Electric, Southern California Edison, and then San Diego Gas and Electric, which is owned by Sempra Energy. And they are the 3 main ones because they are not only investor owned, but they have the largest area geographically that they cover in the state of California. And last year, well, for a number of years now, the utilities have been reporting to the California legislature that there is a need to do some updating of infrastructure and hardwiring through the utility system, and that we have seen some of the catastrophic wildfires in California unfortunately happen because of the infrastructure of the utility systems. And it's not an easy fix just to take things from being above ground wiring to undergrounding. And in some instances, communities don't want that for a variety of different reasons. So just to say that it's a complicated utility system that we live in, and I'm sure that it's similar around the country. With those discussions, though, we really wanted to get at how many people in California, at least as a start, actually use assistive technology and durable medical equipment that requires backup electricity. So we want to prevent as much as we can the possible, and hold the utilities, frankly, accountable for making sure that people with disabilities don't die or are put in harm's way as a result of their power being turned off. And yet there's no data. As we know, there's very rarely data that we need for people with disabilities exclusively on different topics and issues, and us as a population as a whole. So we really didn't know the number of folks we were literally talking about when we entered into this conversation. And what I thought I'd take advantage of at that time last year during the spring was that we have our annual Capital Action Day event where we get over 1,000 people that attend. And I thought, what a time to take advantage of having the community together. Let's rally some volunteers and get some surveys around the Capitol for people with disabilities that are there, and just have them do a quick survey to figure out like how many people just amongst those that are here use backup electricity for AT and DME purposes. And we asked a series of other questions like, are you prepared for any type of disaster or emergency? In addition to, do you need backup power for your AT or DME? Are you on the medical baseline program, which is a program in California utility systems that allow folks to, it used to be that you would go into the public utilities medical baseline program because you get a 10% discount on your bill. And it has nothing to do with being low income. It's for all of us that use AT that requires power. And it's oftentimes, unfortunately, confused with their low income program in California. So we're doing a lot of education around that too. But nowadays, the reason why that list and program is more important than anything else is that it provides advanced alerts on public safety power shutoffs. And so we wanted to ask our people in the survey, are you a part of the medical baseline program? And, you know, we weren't surprised, but we wanted to hear from the community themselves because we very much value the community's inputs and active participation in the work that we do. And so we got what we thought we would find and even more. And so most people in California that do have backup AT or DME that requires power are not aware that the medical baseline program exists, or they believe that it is something that they don't qualify for because they're not low income. We found that we ended up with a little less than 500 surveys completed, and we ran it for an additional 2 weeks online. We found out that a large percentage of people, and I didn't bring the percentages with me, so I apologize, but I'm happy to send it out. We found out that many folks do not have a backup power source of any kind if their power were to go out. And then, you know, the most important part of that survey was how many people are prepared for any type of emergency or disaster. And it was a huge percentage of people that said they were not personally prepared. So with that information, we turned it into an infographic, and you can find it on our disabilitydisasteraccess.org website. We've got a lot of information there, and we of course launched a program as a result. So with those survey results, we presented to the California Office of Emergency Services, other stakeholders, and then the utilities. And the utilities at the time last year, we're planning to do their first public safety power shutoffs. And while we were still in conversation to figure out what a partnership or a collaborative effort would look like to prevent people from disabilities being in harm's way, there was going to be a shutoff regardless. And so we did work as much as we could, because that's what independent living centers do. We serve people with disabilities, and we try to do the best we can with the resources we have. And so last year, prior to really formalizing a contract and agreement, we had purchased hundreds at that time of portable batteries. And it's important to note that they're batteries, not generators. With a lot of the research we did, we found out that generators versus batteries, the liability is very different. Insurance requirements are different. Renters versus homeowners, the rules are all different, and it just made it easier to go with a portable battery. However, we knew going into it that a portable battery was not going to be sufficient to support everyone, and especially not those that use multiple devices at the same time. With that, we purchased one of the utilities, and Anthem Blue Cross purchased hundreds of portable batteries, and we placed them at different independent living centers in California. And we're ready in case if a power safety shutoff were to occur last year, we would have some emergency resources, the batteries, to back them up. Again, we weren't in agreement on anything structurally or financially. So we did have a power safety shutoff, and it was actually a mixed blessing, unfortunately, as an organization to really see what we wanted to really have in place if we were going to enter into any kind of agreement on this type of work. Needless to say, we have. And earlier this year, we launched Disability Disaster Access and Resources, our new statewide program. And because CFILC, we are the membership organization for CILs in California. There are 28 CILs and 24 of them are members of CFILC. 20 of our members of the 24 opted in to becoming what we call Disability Disaster Access and Resource Centers. And so the ILCs are serving as DARCs. How ironic that that ended up being the acronym, but they are serving as the DARCs. And last year we did it very informally, but we provided some backup support to folks that did reach out to their local center for support. However, this year, this week's event, the situation is very different. We are in contract with our public utility, northern-based utility, investor-owned utility, Pacific Gas and Electric. And we've been prepping all year, and we've created a statewide infrastructure and system to be able to provide people with disabilities with personal preparedness planning for disasters and emergencies, to enroll them in the medical baseline program as well as alerts available in their county, to get them involved in training or workshops or town halls on disaster and emergencies. And then, depending on where they live, if they are in a tier 3 or tier 2 zone designated by the Public Utilities Commission as a fire threat area, they are eligible to receive one of those backup batteries. Or if a battery will not work for them, we will put them in a hotel for the number of days that they need to be there during the shutoff. With that said, we entered into an agreement with Extended Stay America. And so we have a statewide contract with that hotel with a special pricing and special code to put consumers in that need that type of service. And so today is the end of the PSPS that just occurred this week. And so we have consumers transitioning back to their homes. But we do have some consumers that aren't able to do that because while they were evacuated for the PSPS, their home was also evacuated for wildfires. So that is what we're dealing with right now. And that's sort of a bigger scope of the question, but you get the idea of the before, during, and after. Right now in the after stage, literally, we are assisting people. Our program provides the transportation if needed to get to and from the hotel or a charging station. So we're providing that, making sure people are getting home safely, making sure if people need to stay in a hotel that there's resources to make that happen. And then we also provide food support for folks that don't have that and need it when they're in a hotel. So it is a pretty significant contract, biggest one we've ever had at our organization, and it is a pilot. So that's very important to know. I'm very hopeful that given the work we've done and shown how important it is to have people with disabilities engaged in this work, that our pilot will continue or become a permanent program.
Thank you very much, Christina. I know you all have been, as you said, working around the clock. This is Marcy speaking. Let's now hear from Jessica Michaud, who has also been on round the clock disaster response.
Thank you, Marcy. I am Jessica Michaud, and we started roughly late summer, early fall of 2016 to provide disaster relief to what we refer to as the Great Flood of 2016 in Louisiana. It affected many parishes, which are counties everywhere else. And so we received over 3.5 tons of specialized medical supplies, equipment, diapers, things of that nature. And currently we have and maintain a 1,500 square foot warehouse. And what we do there is we maintain medical supplies, mostly specialized medical supplies for tracheostomies, G-tubes, urostomies, colonostomies, things like that. We have recently also come into a plethora of diapers, which I'm super excited about because we're dealing with Hurricane Laura right now. So that has been, we took it statewide during 2016, and we have continued our mission, bringing it nationally, like Melissa said, in 2017. We keep this 1,500 square foot warehouse to provide some supplies for people to make emergency kits year round. And that could be anything. We have a lot of chemical plants, oil refineries, things like that. So we've really tried to focus on kind of those type of disasters as well. And then in March of 2020, when COVID came about, of course, it affects our population significantly. So we have started to notice that there was a shortage of medical supplies. And I think we came in handy by providing extras to the people who went from getting 15 items to 5 items a month, or 30 items to 15. And it was just kind of to maintain those specialized medical supplies, including ventilator supplies. So that was really nice for us. Right now, we are currently serving Hurricane Laura evacuees, and that's kind of in a nutshell what we do. Thank you, Marcy.
Thank you very much, Jessica. And now let's turn to Sadie, who is going to talk about yet a whole other set of experiences.
Hello, everyone. Thanks for having me. I'm excited to be part of this panel and this conversation. So my experience started back as I worked with the Center for Independent Living. I had some predecessors that worked with some of the fires that happened in 2012 and 2013 here in Colorado, which caused major devastation here and affected a lot of people with disabilities. At that time, the Independent Center noticed that there was no plan with people with disabilities. There was just a plan for people with disabilities. And what that did is it started affecting resources that are normally used by people who weren't even affected by the fire, such as communication. People who were deaf weren't able to get any information because there was no ASL interpreter, no captioning. And then people with using wheelchairs didn't have accessible sheltering, so they're maintaining their health resources were not available. Transportation, the city went and used all their public transportation to go and evacuate the affected area, which then shut down the access to transportation resources for people with disabilities who use that to get to and from medical appointments, using it as their source of transportation to work and different things like that. And so in 2017, they went, we put together a stakeholder group and advocated that emergency management needed to have representation for people with access and functional needs and people with disabilities, part of emergency life cycle. So before, during, and after disasters. And so with that, they advocated and they were able to go to the Joint Budget Committee and get at least $500,000 allocated to be able to put into the Division of Homeland Security and Emergency Management, and that falls under our Colorado Department of Public Safety. And from there, they hired an access and functional needs coordinator, and I won the job. So I get the honor and the privilege to be part of the conversations. And so my experience was, as I first got into emergency management, I had to help people understand shared language. So at first people were like, AFN, oh, that's just the new thing for special needs. So let's just change the word special needs to AFN. And so the very first thing we had to do is start helping people identify shared language. We were doing a state exercise and a statewide exercise. One of the things that when I asked the question, well, how are we identifying people with access and functional needs? So then in the scenario, they told me they had 60 people with AFN in a shelter. And I said, can you help me understand what kind of resource that person needs? 60 people who need wheelchairs. Can you imagine that in a shelter that we don't have large shelters? We don't have those big shelters here in Colorado because we don't have the kind of disasters that they have associated in some of our other states around Colorado. So the first thing I did is start having us understand that people with access and functional needs are people that need access to resources in order to function during emergencies and disasters. And thank goodness for for the great work that Marcy did at FEMA. When I pulled up AFN, it actually pulled up CMIST resources, CMIST resources. So people, those are the resources that usually cost people their lives. And so that's where we're starting in Colorado. And boy, did we have an aha moment for emergency management. And now we're all speaking the same language. In fact, all of our plans had whole community inclusion and didn't even identify people who needed access to resources in order to function. They just had all these things and people with AFN in an annex. And so it's been a really nice opportunity to be able to help come together with shared languages. And now when I'm asked, now when I'm listening to some of the report outs, when they are talking about people with access and functional needs, they start identifying communication resources, maintaining health resources, independence resources, safety, service support resources, and transportation resources. It's really doing well now that we're getting a little bit used to it. I've been here at the state for since November of 2018, so a little over a year and a half. And one of the big areas that I've seen from, we don't have as many devastations. We do have fires, and later on, hopefully I'll be able to talk about concurrent situations. But prior to that, AFN just meant, really, I think everybody just thought it was the new word for special needs. And that was, it's really nice to see that we're now moving forward with that. The only after the big one that I've been in as far as the big event in disasters here in Colorado was the bomb cyclone. So it was a devastating blizzard, basically, that shut us down for about 4 days. It shut down, the first time I've ever seen government agencies even shut down so that we could make sure everybody was safe. And during that one, the thing that came to me was that they had people with AFN that needed it, 900 people with AFN that needed to go into a shelter. Had no idea what that meant. And so that's when we started the idea of, okay, what is the actual resource need? And so as we learned through that, we've just been progressing forward on that. We're doing a lot of things over here, and all simultaneously, because we're doing things before certain events. We're doing them as the events are happening. And then right now, we're even concurrently doing response and recovery with the whole COVID stuff. So yay, awesome. Thank you for asking me.
Thank you very much, Sadie. And now Maria and I have worked together in a number of disasters, and here we are again.
Yes. So first of all, everyone, thank you so much for having me. It's a real pleasure to be here virtually with all of you, and always good to be with so many advocates that I respect and have often been in the trenches with in a variety of ways. Like Jessica, I am also from South Louisiana, so disasters have been a part of my life for as long as I can remember. And I had my first, the first time I realized the intersection of the ways in which people with disabilities are disproportionately impacted by disasters was when I had family members who lost their lives during Hurricane Katrina because they were receiving dialysis and the electricity failed and then the generators failed. I couldn't quite articulate exactly what happened, but the reality was that a lack of inclusive planning allowed a natural disaster to become a human-made and systems disaster for my family and the families of so many others. So professionally, as Melissa mentioned, I ultimately went on to work in the Office of Public Engagement, managing the disability portfolio for President Barack Obama. And because of my background in the area, I helped manage the White House's response to, I believe what Jessica called the Great Flood of 2016, but what we called in Houston the Memorial Day flood, and in Louisiana. And then after that went to the mayor's office in Houston, where Hurricane Harvey hit in August of 2017. And while I was in Houston, helped manage responses to hurricanes, chemical fires and spills, as well as heat and cold emergencies. And it was really during Hurricane Harvey where a community-centered response and saved lives. There was a real emphasis on a disability registry in Texas. And if you come away with one thing from this presentation from me, I hope it's that you hear that registries don't work. The assumption that people with disabilities will always remain in one place, especially during a disaster, is one that is based on really hurtful stereotypes of disabled people. And the registry that was meant to help track down people with disabilities impacted by Hurricane Harvey. In the fourth largest city in the country, in the third largest county in the country, only 4 people were contacted. And it was really through working with community organizations that were led by disabled people that we were able to really understand what was happening across our city, and work with a number of partners, both locally and across the country, to get replacement durable medical equipment and case management services to folks that really needed it. Interestingly, and Connecticut is a much different state, but in Texas, Houston is the only city with a formal mayor's office for people with disabilities. And what wound up happening is that impacted communities from across the state were contacting our office for assistance because no other local entity had any kind of formal system set up. And so this is the example I'll use to say that counties and cities need to be investing in formalized disability programs so that folks know where they can go and receive support or coordination. There is no reason that an office based out of Houston dedicated to a Houston population needs to try to figure out how to serve people in Beaumont, which is a completely different area of the state, but that's what wound up happening. Now I'm at the American Association of People with Disabilities, a national cross-disability civil rights organization. We have been doing a ton of work around advancing and amplifying the needs of people with disabilities impacted by COVID. But the most pressing issue on my mind today, and actually the phone call that you all may have heard, come from my family members who are currently evacuated to Texas because of Hurricane Laura. And this includes my 8-year-old nephew who is autistic and nonverbal. In the past 2 weeks, my family members have barely been able to find a hotel to provide shelter because of both states, Texas's and Louisiana's, lack of systemic inclusive planning, and they are currently being forced to drive 5 hours from where they are staying to find new shelter because they were kicked out of their hotel yesterday. Even though we are experiencing concurrent disasters in the middle of a pandemic, the state of Louisiana has yet to activate transitional sheltering assistance, meaning that there are very, very limited hotel options for evacuees, but we do not want to encourage mass congregate shelters when there is such a huge risk for the virus to spread. And what I have seen with Hurricane Laura, and I'm sure Jessica can attest to this, is that the current disaster planning does not match the lived experiences of those most impacted. And one of my mantras is that you always measure impact and not intent. You can create the best disaster plans on the planet, but ultimately, if they don't help the people who are most impacted, it doesn't matter. So with that, I know we're running out of time, but thank you all for having me here.
Thank you very much, Maria. This is Marcy speaking. And I love that mantra and absolutely share it with you. We are getting close to time. Excuse me. I'm now getting a message that we might be able to go a few minutes longer. And so I'm going to ask each of you in a sentence or maybe two, what's your current daily engagement with stakeholders due to your current involvement in disasters, and for many of you, concurrent disasters. And I will start by saying that at least once a day, I participate on phone calls led by the Partnership for Inclusive Disaster Strategies, the team that Melissa is a part of, and on a daily basis, at least once a day, we meet with folks from across the country for an hour. So that's at least once every day. Now I'm going to turn to Christina and ask you in a sentence or two, how are you engaging with stakeholders?
I would say mine is very mine is very similar to yours, at least once a day for 1 hour. But during events, I would say it's multiple times a day.
Thank you, Christina. And Jessica, how about you?
This is Jessica. As of right now, with Hurricane Laura and COVID, we are engaging in conference calls twice a week. But with governmental stakeholders, we have text messages and phone calls and email strings several times a day.
Thank you, Jessica. And Sadie?
So I'm in it daily, and it's more than an hour a day because I am a primary resource here in Colorado. So daily, I'm at least on a partnership call or a stakeholders call, whether it's locally up to the state level, or I'm also an email resource for our healthcare policy and finance for when people who are living independently can't find personal protective equipment. There's lots of different areas. I do try to get on those daily calls, but I'm pretty maxed out at the time, especially when there's simultaneous stuff happening. So that's how I'm staying engaged.
Thank you, Sadie. This is Marcy speaking again. And how about you, Maria?
AAPD participates in very regular calls with led by the Partnership for Inclusive Disaster Strategies. We also are in regular touch with other disability groups around the country and try to understand what's happening to members who are on the ground and relay those issues to governmental entities like Health and Human Services or FEMA.
Thank you, Maria. And one last question for everybody. One good or promising practice that you think others might be able to take and make work where they are. And I would say, I'll start and say, and this just goes along with what we were just talking about, bringing folks together on a regular basis to anticipate potential problems before they happen, and then problem solve with a group of people, some of whom very knowledgeable, some of whom are new to disaster response. That's a promising and good practice that I think can be replicated anywhere, nationally, globally, and locally, and even hyper locally. How about you, Christina? One good or promising practice?
Yeah, I'm never short for words, Marcy. And so I would just say that I see it through two ways. I see it the individual and the systematic way. And so I think we can do a whole series on planning itself. That's endless conversations. But there's two things that I live by. One is systematically, if we're not planning for all, it'll never work for everybody. That's my mantra, and that's, similar to what Maria said. And then secondly, what one of my mentors, Richard DeVelder, always taught me is when it comes to individuals with disabilities like ourselves, we need to plan like no one's coming for us. And I live for that.
Thank you very much, Christina. And Jessica.
One thing I suggest, and one thing I love to see and would hope to see more frequently, is the engagement between governmental entities and really grassroots organizations, because those are the individuals that have the most contact with individuals in the community.
Thank you, Jessica. Sadie?
So one of my approaches are both systematically and individually is plan with, don't just plan for. When you plan with, you seek to understand and you start learning solutions. You don't just hear the problem, because people who actually live it have a solution. It's just we have to start utilizing that solution. And then with that, we're able to share those resources as well as force multiply. We don't only keep it to ourselves, we start force multiplying with all of our partners, and again, individually and systematically.
Thank you, Sadie. And we'll let Maria have the final word.
I agree with everything that's been said, and I will just add, teaching people what to expect in terms of the disasters are unpredictable, but the system's response to disasters is predictable. When someone has experienced a traumatic event like the loss of a home or a family member or displacement, they're not going to be at the top of their game being able to navigate bureaucratic systems that are difficult to understand. But if people know, I have lost my home, here's who I should be touching base with, here's what I should expect to hear from a local Red Cross or FEMA, they can have at least some understanding of what they should be receiving and a better awareness of how to correct things if they go wrong. Oftentimes I see the disaster response system traumatizing individuals in very similar ways to the disaster itself, and we have to stop that.
Thank you very much, Maria. And in closing, I think we've all been saying this in many different ways, and I want to be very intentional as we wrap up and say that the numbers of people who are multiply marginalized, people who are Black, Indigenous, people of color, people who are poor, LGBTQIA, many people who experience poverty are disproportionately impacted again and again and again in disasters. The loss of life among people with disabilities has been unbelievable. And the numbers of people, I saw some data yesterday that the number of Black disabled people who've lost their lives from COVID has been twice as high as everybody else. And the devastation of the failures in the system have got to propel us forward to continue in the work that we're doing. And so one promising practice that I have to give a huge shout out to is the Connecticut State Independent Living Council, bringing folks together early on to begin this discussion, and then reaching out to your community to find out what people wanted to learn more about, and then bringing people together to continue that dialogue. So great example of a very promising practice that can be replicated everywhere. I'm going to now turn back to Melissa, and thanks to each of our panelists for all that you're doing, and to the Connecticut State Independent Living Council for your leadership.
Thank you, Marcy. That was a great panel. Just to avoid confusion, so to clarify that in another life, I am the director of operations for the Partnership for Inclusive Disaster Strategies. That's why people are mentioning me in connection with that, because I realize Connecticut people might not know that about me locally. First, I'm going to introduce Bev Kidder. Bev is the current vice president for the community programs for the Area Agency on Aging for South Central Connecticut. She holds a doctorate from Columbia University School of Social Work with over 50 years of experience in social work and healthcare, concentrating on issues of aging, rehabilitation, depression, caregiving, Medicare, and discharge planning. She's held academic appointments at Columbia University, Housatonic Community College, Sacred Heart University, and Yale University. Eileen Healy, who's going to be the panelist after her, has been the executive director of Independence Northwest Center for Independent Living for 32 years. I knew Eileen before she was executive director, just saying. Under her leadership, Independence Northwest was one of the first centers for independent living in the country to offer services for people living with HIV and AIDS. She's the current president of the Connecticut Association of Centers for Independent Living, CASIL, and is the former chair of the Connecticut State Independent Living Council. Eileen received the National Council on Independent Living Region 1 Advocacy Award and the 2018 Leadership Award from the Connecticut CILC. I'm going to ask a question to both of you, and I'm going to ask Bev to respond first, if that's okay with you, Bev. And what is your organization doing specifically during the pandemic, such as food delivery, assistive technology, etc.? This can be directly related to the CARES Act funding or specific local initiatives. I'm going to turn it over to Bev now, and I'm going to mute and shut off my.
Thank you very much. It's a pleasure to be here. And I'm sorry that we're running so late, and I certainly understand if some people can't stay on. So the Agencies on Aging did a few things. Initially, as soon as the pandemic struck and we realized we're no longer able to stay working as we traditionally were, on March 8th, we transitioned all our staff to remote working. Easy to say, difficult to do. About 50% of our staff were prepared for remote work. By that I mean they had the correct equipment, because we were planning to utilize more remote work for all of our programs. It just all happened faster than we had the funding to make happen for 100% of the people. But we grabbed everybody and we sent everybody home. And for a lot of management, they felt like, whew, well, now that's over. What's the next thing that we do? But making that decision and sending everybody home started up as a manager, a real challenge, a real difficult process. And I'm so pleased and proud of the way the agency was able to respond. We have, at any given day across the programs of the agency, we are serving about 5,500 people in the multiple programs. That's a lot of people. And we made a commitment to find out from every single person ASAP, where are you, how are you, what do you need, how has these COVID changes, the government's regulations, how's it affecting you, what do you need? And we divided up all of those clients amongst all of our staff and all of our volunteers. We're fortunate to have hundreds of volunteers who are willing to work with us. And every single person got a call from us so that we could do a very, quick assessment of where are you, what do you need, and then begin to farm out the work and figure out what are the resources we have. And on a case-by-case basis, had to come up with solutions. That was an exhausting amount of work. We worked through the night. We worked through the weekends. Everybody on our staff just really jumped in and did that stuff. So I think it was one of the most appreciated things we've ever done from our consumers. All of our consumers are elderly. You have to be elderly to be served by us in all of our federally funded programs. A large number of our consumers are older adults with disabilities. A much smaller portion, but still a significant group of people are individuals with disabilities over the age of 18, but under the age of 60. Various needs identified amongst those groups and individualized plans for every one of them as to how can we compensate for the fact that things have changed. The primary things that when we looked at, okay, we've talked to all these people now, what do they need and how are we going to do it? Food was the number one thing that people needed. And so that was something that was only a financial challenge for us. We and the agency made a commitment to, we'll figure out where we get the money later. Right now, we'll take the rent money and we'll use it to buy food for people. And that's what we did immediately. A group of our staff folks stepped forward and said, I'll go shopping for people and I'll bring food to their houses. Tell me who needs it. So that's how we started. And one of our staff person was appointed as the point person for this. And the most important thing the point person had to do is go out and find us another 50 people who are willing to go shopping, to buy groceries, to go to the stores, to deliver it to people's homes. And we, in a pretty short period of time, successfully recruited 50 people so that we could do this program in a way. And at the same time, start applying for money. In the first month of the program, I was able successfully to apply for and get grants from a half a dozen different organizations to give us the money to keep buying the groceries. So that was one of our responses. Another, as we were doing this, we found that lots and lots of folks needed in-home services, homemakers, home health aides, PCAs, that sort of stuff, because they had been utilizing services at places like going to the senior center, going to the adult daycare center. So they were getting some help in medication management, things like that, that now being isolated, they couldn't get. And so we were identifying who needed those services, brokering those services, finding funding sources for people. And so we've been doing that. People started calling us like crazy, looking for help. And a lot of the help was, who do I turn to for this? How do I get that? What do I do? So we always take a lot of information and assistance calls, but the volume of it really increased. And so one of the things we did, we run the Choices program in Connecticut, which is the health insurance counseling program. And it's a large volunteer base, mostly professional individuals, whether they're retired or still working, but individuals with a good deal of knowledge and information and skills. We reached out to them and we said, volunteer for us on this, take calls for us. We're all working remotely anyway. We'll transfer calls to your home And so lots and lots and lots and lots and lots of people have been helping us take this surfeit of calls that we've been getting so that we could be responsive to people. So we put that in place. We started a second food program because the fresh food program was great, but it's a one-shot deal. People have ongoing need for food. We started something called the grocery bag program in our region. Many of the AAAs have a similar program in their region where we bring a couple of bags a week to people of the kind of food that you would get at a soup kitchen. And the reason it's the kind of food you get at a soup kitchen is that's where we get them from. We contract with area soup kitchens to pack the bags for us. Our volunteers go out, pick them up, and deliver them. And we're doing 30 to 40 a day that we're delivering groceries to, and we're doing that 7 days a week. Excuse me. So that has been very, very successful with us. We have people needed PPE. So the second most thing that people called us for was they wanted PPE. They couldn't get it. And we had a lot of trouble getting it as well. But we did, there was free stuff that you could get from various government organizations. We got every bit of it that we could. We got CARES Act money. We bought a bunch of it. But you sometimes just couldn't find it. So a group of our staff got together and spouses of staff and started making masks for people that met requirements for the lowest level of the mask. So we got these masks, we put together, it was like conveyor belt sort of stuff, gazillion people together, a lot of volunteers, some agency staff, and we began sending out a supply, 5 masks to every one of our known clients. The state gave us masks for people on Medicaid waiver programs, but we had to ship those out. They gave us the equipment, but we had to figure out how do you get it to people. So we did a lot of home delivery. Our food people also delivered. We did a lot of mailing as much as we could with that. And that has been extremely successful as well. So those are some of the things that we did in response to COVID. And I'll turn it back to Melissa so Eileen can talk about what they did.
Thank you. This is Melissa again, and I'm going to ask Eileen to respond to the same questions. What is Independence Northwest been doing? And I'd also like you to talk very briefly, because we're short on time, about what Independence Northwest has done around transitioning people out of nursing homes. And I realize that's a long story, but if you could say a sentence or two about that, in addition to answering the question, that would be just great. Thank you, Eileen.
Hi, this has been really wonderful, and I want to thank the first panel. I've learned an enormous amount, and I've taken lots of notes. So thank you for that. Independence Northwest has been doing a multitude of things. We started with food. We started working with food pantries, in particular, local growers, farms, End Hunger Connecticut. We looked for opportunities to, one, make sure that people had access to food, but also to educate them about why can't they build in the accessibility needs of people with disabilities that may not be able to get to the pantries. And trying to figure that stuff out instead of creating kind of siloed, segregated services. So we started to do that. We saw that there was a need for 3 different kinds of food programs. One is actual food groceries that people needed, and perhaps they could go, but they didn't have transportation. Others couldn't go, and they couldn't pay for it because they had a SNAP card. And then the third group was individuals that needed an immediate meal, and perhaps they didn't have personal assistance, perhaps they were separated from family, and others that might have provided meal preparation. So we worked with a couple of local restaurants that we frequented all the time, and got them to agree to be able to provide like a large lasagna, or offer a couple of different kinds of things, and they would in fact even deliver it to the consumer. So those were the 3 areas that we initially started. We also, like the AAAs, reached out to most of our consumers that we could get to. And what we found was most were pretty well situated. And maybe that's because a lot of our consumer base are folks that are on benefit programs. So their incomes weren't necessarily impacted. What we did see was people that had reduced work, that lost their employment. We started seeing a lot of folks that we didn't necessarily know. So it's been a real learning experience in a lot of ways for both us and the consumers that have reached out to us. As part of the ADRC, Aging and Disability Resource Centers, we were given funding from the state of Connecticut Aging and Disability Department to do an isolation survey, realizing that people would be potentially very isolated in their homes during the COVID. So we started working with them. They have an isolation survey that is being conducted through a professor at Quinnipiac. And we're doing isolation questions, helping people to identify, are they eligible? And if they are, then we're identifying resources for technology, whether or not they need a cell phone, do they need an iPad or some other tablet, or the biggest burning issue is how do you get people internet that can't afford it long term. So we're kind of still working out some of the kinks on that project, but it's really interesting to see what people need. It's also an opportunity for the AT partners who specialize in providing assistive technology evaluations, how they can help individuals identify how do you make it more accessible. You know, an iPad's an iPad, but you know, you don't have speech perhaps, or you have limited mobility. How would you work with that and provide the adaptations necessary to do that? Independence Northwest took an additional approach, especially with our Independent Living CARES Act money. And we have hired a community advocate. And his job, his name is Rich Luby, and his position with the center, and he's been there since July, is going out into our local communities, and we have 44 towns that we are responsible for, and starting to build in that systemic, inclusive planning and cross disability. We want to ensure that it's not just focused on those that will use wheelchair users. We need to be able to incorporate folks with intellectual disabilities, folks who are deaf. I think a lot of the COVID stuff that we have encountered has really opened up, you know, the real gaps in the differences between the disability groups and their actual functional limits that they may or may not have. So that's one of the things that we're hoping to do, is to have an impact that has a long-lasting impact, not just something real like food delivery is perhaps time limited. So we wanted to go that route. In addition, just recently, and at the end of the month, people will start the Kinetic Core, which is sort of similar to Vista and AmeriCorps. We have 2 volunteers that we applied for and received, and they're going to start at the end of September working with us in both volunteer recruitment to help us work on those systemic inclusive plans in their local communities, as well as working with individuals on the food. We obviously purchase PPE. I know one of the other centers was doing backpacks and filled them with things that were beneficial during the initial stages of the pandemic. Just trying to figure out what it all is that people needed. It's been very different from person to person. There is no one right way to do it. What I may need may be very different than what Bev might need. And I think it's really important. One of the comments that I heard was, you know, we kind of have to do with the person, not for the person, and take those experiences that we've learned and broaden them to a wider audience and wider planning, so that we are learning from the people that are most impacted by it. So that's kind of us in a nutshell. I know I was supposed to do it quick. You asked about nursing facility transition. Surprisingly, we are transitioning more people than we ever have in this period of time. And I can't totally explain why. I do think some of it is that families are not working People are desperate to get their family members out, and individuals that are currently in nursing facilities are desperate to get out. So the process of like, oh, this doesn't work so well, I want to look at something else. People are more inclined, I think, to just go. So that's been a real eye opener in a lot of ways. And IN is, you know, we have staff that's working on the Mathematica, which is the study of what happened in the nursing facilities in Connecticut, providing feedback on that. We've been involved in the medical rationing, which we're trying to put together policies for Connecticut hospitals so that they're not all over the place and that they're not using discriminatory standards to determine who gets care and who doesn't. So we've been busy.
This is Melissa back. Indeed, you have been busy, Eileen. And I asked the transition question because I knew the answer to it, and I wanted you to be able to share that really good and promising practice. Next, I'm going to add the next question is: does your area council on aging or your Center for Independent Living partner with the local area council on aging or center, and how? And how can consumers and other disability organizations connect and collaborate? Partner with you, with CILS, and with other area agencies on aging? And I'm going to turn to Bev now.
So that's a good question. I read the question and I actually had a conversation with Eileen and I said, I don't know, but I can share with you what we're doing. And the reason I feel like I don't know is I don't feel as yet any model has come into my mind or that I have seen that says to me, oh, this is the way to go. As you may remember, there was some funding a little while back when we established ADRCs in Connecticut to have a greater partnership and collaboration between the CILS and the agencies on aging. And in our region, we entered into a memorandum of understanding. We did co-location of staff. We sent people to our local CIL to actually work with consumers there. Our local CIL sent people over to our agency to train our staff and to help us train the public. So there was a lot of activity. But as with all these things, when the funding goes away, it's really difficult to maintain those things. So although we have a very cooperative relationship with our local CIL, as I'm sure is true in CILs around the state, you got to put your money where your mouth is. And when you just don't have someone designated with that's their job, it is much more difficult to keep the channels of communication going, the referrals going, the warm transfers of clients, and all the things that we talked about as wanting to do. The focus really has been more on the no wrong door model as opposed to the ADRC model, clients self-serve through the internet much more. And so it's more difficult to keep our roles going, and I don't know exactly what the correct model is. That being said, one of the things that manifests itself to us during this COVID business is we got calls from lots and lots of folks across the age span with disabilities. And in many, many, many of the cases, particularly people who had communication disabilities, we found the amount of time, we allocate on average 15 minutes per caller and, X number of callers per hour times the number of staff we have. People had need for more time than we were able to do. So, we put the time in, you have to do what you have to do. But that meant more people were dropping off that we were not being able to get to. And it struck me that one of the things that we could do in a preparedness way, working with the CILs, people in the community responded, they want to volunteer, people want to be helpful in a disaster. How can we capitalize on that and maybe create a cadre of volunteers that we could call in who had willing to commit those extra hours to give that one-on-one follow-up with people after people say, this is what I need. And then we quickly say to them, well, these are the resources, next caller, that somebody could be there. There's no way anyone's going to hire enough staff to always have them in place in case someday there's a disaster. But how do we recruit and retain a core of volunteers who are trained in disability issues, who themselves are, I would hope, people with disabilities who have perhaps a more unique understanding of the situation. So that's the thing that I'm hoping to, in our area, to when we can breathe and some of this is over and we think about tomorrow, that's something that we can, I can talk with the SIL in our region, and I would think other SILs around the state could perhaps get together and look at how do we put this together so that we can be more responsive to people for these long-term one-on-one needs. Not everything is easily handled by a systematic answer. Sometimes you need a partner with you working on these things to provide support. So that's my response.
This is Melissa again. Thank you, Bev, for your response. Eileen, do you have a response to that? And I'm going to ask you to be brief just because I'm sensitive to the needs of interpreters and I want to be respectful of everyone's time as well.
I understand. Thank you. And I will be brief, and I would echo a lot of what Bev has already said. I think that there are huge opportunities to partner with the AAAs as well as other organizations within the community. We've just started to do an ASL class for employees and volunteers of our local AAA. That's not necessarily COVID related, but it's a start to kind of start to build it. I think part of the difficulty in terms of providing services to people has been there's such an overlap in terms of the consumers. So we'll get people that are 60 and older. Do we really bounce them over to the AAA if they have a disability just because of their age? We would likely provide services for them. So I think trying to figure out a way to maximize the resources of both entities would be really valuable. And like everything else, you know, we're in a situation where, you know, all of the priorities haven't hit the top of the list yet. So I think that's part of it. I think one of the things that the AAAs do incredibly well is volunteers. And that's something I certainly can say for my center is a weak area. And if there's ways to partner on how we do recruitment, do they identify some folks that we might benefit from? Are those individuals interested in working with the SIL? I think there's lots of opportunities. We just haven't taken advantage of all of them.
This is Melissa, and now is as good a time as any to take advantage of those opportunities to collaborate. And SILs, I encourage the SILs and AAAs to get to know each other, and that's great. I first of all want to thank the State Independent Living Council for inviting us to do this, for creating this opportunity, for having this panel. I think it's a really important model that's being used nationally, and Marcy talks about it a lot on the national stakeholder calls about what Connecticut is doing. So it's great that we get that shout out periodically, and I'm sure we will tonight. So that's very exciting. And so I want to thank the State Independent Living Council. I want to thank Disability Rights Connecticut. I also want to thank all our wonderful panelists. All of these experts in one space at one time is just kind of amazing. Local Connecticut experts, national experts, Connecticut experts who are also national experts. So I want to thank all the panelists. And mostly I want to thank the people that participated. There's lots of you on this call. I encourage you to keep coming, and I really, really appreciate you all being here. There will be a YouTube link, there'll be an evaluation that we'll be sending out with a YouTube link in the next day or so you can watch this and share this with other people, because not everyone could do it between 4 and 5:30, or maybe someone said something you'd like to hear again. We can create that for you, so that's really a good opportunity. Lots more people listened to the YouTube link when we sent it out last time in March, so that will be available, and there'll be an evaluation. It is critical that you complete evaluations, because in terms of our funders and their funders, our funders, if there isn't an evaluation, it didn't happen. So please complete the evaluation. Also, we really want feedback on what worked, what didn't work as well, so we can have that inform how we present this next, because we're still learning how to do webinars like this. So thank you, everyone. Stay safe. Have a great rest of your day. Thanks again. Bye-bye.